You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. As with every episode, we start off this one stating that the intended audience are currently working informatics pharmacists. IBM Watson Health identified three major trends that will be impacting healthcare IT in 2019, and they are value-based care, physician burnout, and personalized medicine. Today, however, we'll be actually focusing on physician burnout and how we as informatics pharmacists should be using our skills with technology to help reduce this problem. My experience is on the inpatient side, so I'll be discussing it from that standpoint. So let's talk about physician burnout. We all know what physician burnout technically means. When a physician is burnt out, they are more likely to make mistakes and cause patient harm. The Minimizing Error, Maximizing Outcome study of 2014, they revealed that physicians reported stress and time pressure as a result of electronic health records. 1 hour of direct patient care resulted in about 1 to 2 hours of documentation in the EHR. Even after hours documentation resulted in burnout. And I've actually personally seen some of my friends who work in the healthcare industry as a provider get stressed out when they have to continue charting at home on their patients. So, as a pharmacist in informatics and technology, what do we do to help reduce burnout? Part of that burnout is the complicated navigation of electronic health record. Whatever we can do as informatics pharmacists that will help the provider's workflow and allow them to do their clinical job easier, while of course, still maintaining the integrity of the data, will greatly assist in physician burnout. When the term physician burnout gets used, it sometimes sounds like the focus is on the provider, but you gotta understand too that external forces like the healthcare IT or informatics team, they should play a large role and large part in helping with the reduction of the burnout of the provider as well. So let's go over some of the options that can be done using pharmacy technologies to help assist with physician and eventually pharmacist burnout. The first thing is robust electronic order sets. If we have the most common problems mapped out for the patients in the health system, order sets for their common orders can be made. These order sets will help providers with not having to navigate through the complicated order screen to find every single little order that pertains to whatever condition the patient has. This is basically just all put into an electronic order set that makes it easy for them to choose that for that condition and then order easy. The other thing is reducing alerts. We need to reduce alerts to only the ones that are actually clinically relevant. It's quite known that alert fatigue has reared its ugly head many times in the current state of EHRs. We have to analyze alerts on a continual basis and reduce the amount of alerts down so that the provider doesn't get stressed out and eventually ignore them. Another thing that we can do is helping with documentation templates. So documentation templates is another aspect where we can help providers not feel as much of a burnout. Providers constantly write progress notes on all the patients that they see, so having templates that pull data in from the EHR helps with their documentation workflow. Rules in the system based on a lot of clinical logic would also help out. For example, having a rule in the system to convert a patient from IV antibiotics to PL antibiotics based on the patient's status would take away that task of the provider having to remember to review it, but rather be presented with that info up front so they would just agree or disagree to it. There are many more things that can be done to help provider burnout, but the key takeaway is basically using any piece of technology from a pharmacy standpoint to make the provider's job less stressful and intensive. It's important that we do keep this in mind because pharmacist burnout is also a real thing, and that will be the next step for us to ensure that the healthcare team is providing the best care to the patient. Alright, if you like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme or on Instagram at Pharmacy Informatics. Or you can email us at pharmacyitme@gmail.com. You can also follow me on my personal Twitter account at TonyDowPharmD. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.